Thank you, Dr. Gershon, and thank you to the board and the faculty for this incredible honor. 28 years ago, I sat where you sat, thought what you thought, asked myself, is medical school really over? Will I be a good doctor? What will the future of healthcare look like? Where do I fit in that future? Will I survive those coming changes? My answer to each of these questions was the same. I don't know. No one does. But I do know a few things after nearly 30 years in this crazy profession. You are a flip of the tassel away from entering. I learned the first one when I was a little older than most of you. I was in my second year of residency, near the end of one of my every third night ICU rotations. Exhausted, I'd have fallen into a deep sleep when a nurse woke me up to tell me a patient who was septic, filled with infection, had become acidotic. That means a level of acid in bodily fluids so high that it could kill you. Still foggy, I sat up in bed and said, "Give her an ample bicarb." It was a reflexive response. I know bicarbonate the base would correct the acidosis, and as soon as I said it, I laid my head down and fell back asleep. 5 minutes later, I woke again, covered in cold sweat. And I'm not just using that phrase here, I was in a cold sweat. Somewhere in my subconscious, I remember that this woman, this septic patient, had had end-stage renal disease. Her kidneys had failed and she was retaining so much fluid, it was straining her heart. As many of you know, bicarb is short for sodium bicarbonate, and sodium is salt, and the salt would make her retain even more fluid. I had just ordered the remedy that could kill her. Fully awake, heart racing, I ran to her room. I was too late. The nurse had followed my orders. What I experienced next was panic. My stomach churned, my heart raced even harder. And these thoughts raced through my head. Will she die? God, I hope not. How am I going to fix this? Who should I tell? What should I do? Is this the end of my career? What the hell is wrong with me? No one likes to risk his reputation, to claim he made a mistake, especially a potentially deadly one. But at 2 a.m., I called my ICU attending, I called the patients attending, I called the nursing supervisor, and I called the renal fellow, and told them all the same thing: I screwed up. Nobody yelled, nobody fired me. Instead, together we agreed to assemble a team to perform ultrafiltration to draw off the fluid before it did any damage. It worked. The patient made it. She survived. Not because of me, but because of the team that gathered around me. They all wanted her to live, and they all wanted me to succeed. Everyone wants you to succeed too. That's the very first thing I want to leave with you today. One of the things that I hope you will never forget. We are all rooting for you. Your teachers are rooting for you, your bosses are rooting for you, the institutions you work for are rooting for you. So are your patients, your family, your friends, your spouses, all of us. We love you, we need you, we want you to be happy, confident, good at what you do, in love with it. We want that for all kinds of reasons. And one of those is that someday we may need you to take our pain away, to help us walk again, to give us back energy to play with our kids or grandkids, to save our lives. Close your eyes now for just a minute and picture in your mind the world of people who are behind you. So many of them are here today. Imagine them in the stands on their feet cheering you on. And whenever you find yourself in a tough situation, come back to that image. Imagine everyone who cares about you cheering you on, because we are. I have another message today. This one comes from a different moment early in my career, one that I will never forget. It was July 1st, 1988, the first day of my internship, my first day as a doctor. I was on call, and because my last name began with B, I got the first admission to internal medicine, a transfer from another hospital. When I walked into the room, in the emergency room, a middle-aged woman was sitting up in bed, dressed in a hospital gown, looking very anxious. I began with the textbook question, "What brought you to the hospital?" She said, "They think I have Churg-Strauss vasculitis." I remember that I had studied that disease a while back. Remember it was serious, but I couldn't remember what it was or what organ system it affected. In fact, I couldn't remember anything else about it. I felt unprepared, like I had nothing to offer, that I was useless. But I kept going. I thought, all right, Akram, just keep asking questions, as many questions as possible, and maybe you'll get a clue. If that doesn't work, try the fake it till you make it idea. Maybe that works for doctors too. I took a detailed history, asking questions about diseases in her family and what medication she was on. As I was wrapping up, she looked at me and said, "So what do you think, Doc?" I stopped and thought for a few seconds. I thought about saying, "Oh, well, we'll have to see." Or, "We need to run some tests." Or something else that would make me sound like I really knew what was going on. But when I looked at her again, I saw how concerned she was, and different words popped out of my mouth. "I don't know." I was embarrassed to admit it, but to my surprise, she wasn't angry or afraid. She chose understanding instead. Immediately, I promised her that I would learn as much as I could about Churg-Strauss vasculitis before the next day. I told her that every day she was here in the hospital, I would do my very best to gain the knowledge I needed to take good care of her. She died. But it was 13 years later. And every one of those 13 years, she was my patient. During those years, she told me more than once that the reason she trusted me with her life was because I had been honest with her. That honesty humanized me. That those three little words, "I don't know," made her believe in me. I kept my promise to her. I sought out those who knew more about her deadly vasculitis than I did. I asked them to teach me what they knew and to be my partners in her care. Together, we gave her 13 years she might never have had. I don't know. Don't be afraid of those words. They are the start of something beautiful. And they're a reminder every day that we are doctors, not supermen or superwomen. You see, in America, we celebrate the Lone Ranger. And what we really need to celebrate is the Fantastic Four. No, the Justice League. Sometimes, not often, you need the elongated man, the Red Tornado and Wonder Woman to get the job done. Having Martian Manhunter with his genius intellect and regenerative healing helps too. Remember, you don't have to be able to do it all or know everything. Your teachers don't expect you to, your colleagues don't expect you to, and your patients don't expect you to. The only person who insists that you have all the answers is you. Say, "I don't know." It's one of the smartest, bravest things you can say. It will take the pressure off. People will trust you. Nobody believes a know-it-all. Amazing things will happen when you say, "I don't know." I think of the late poet Wisława Szymborski said it best. In her 1997 speech accepting the Nobel Prize for Literature, she talked about why she loved the three-word phrase. Quote, "It's small," she said, "but it flies on mighty wings. It expands our lives to include the spaces within us as well as those outer expanses in which our tiny earth hangs suspended. She said, if Isaac Newton had never said to himself, I don't know, the apples in his orchard might have dropped to the ground like hailstones, and at best, he would have stopped to pick them up and gobble them with gusto. Had my compatriot Marie Curie never said to herself, I don't know, she probably would have wound up teaching chemistry at some private high school for young ladies from good families, and had ended up her days performing this otherwise perfectly respectful job. But she kept on saying, I don't know, and those words led her not just once, but twice to Stockholm, where restless questing spirits are occasionally rewarded with the Nobel Prize. Be restless questing spirits. Explore always. Exploring leads to discovery, and discovery to whole new worlds. And those worlds to the theory of radioactivity, the laws of motion, and great things we never imagined were possible, things that make the world a better place. That is why you, with your beautiful knowledge you've acquired over the past 4 years, why you are here. You are here to make our patients better, your communities better, the world better. And you do that by being restless, questing spirits. You do that by saying, I don't know. Those 3 words are the start of something beautiful. That is one thing I know for sure.